Okay, let's dive right into this. Welcome to The Explainer. Today, we're unpacking what I like to call a medical detective story, and it's one that impacts hundreds of thousands of people every single year. We're looking at a decades-old medical debate, a condition that can absolutely derail your life, and some brand new, high-level research that finally brings clarity to a very confusing crossroads in patient care. We're going to take some incredibly dense data and break it down into clear, simple takeaways so you can understand exactly what's going on behind clinic doors.
So think about this for a second. What if the cure to your severe, debilitating neck pain depended entirely on a single, often overlooked hidden detail? I mean, we've all either experienced chronic pain or we know someone who has, right? And the universal frustration is almost always the same, just finding a treatment that actually works. You go to the doctor, you describe your symptoms, and you hope for a straightforward fix. But as we'll see today, when it comes to the spine, relying just on the symptom to choose your cure might actually lead you down the completely wrong path.
The condition at the center of our investigation today is cervical radiculopathy. Now, I know the name sounds super intimidating, but honestly, the reality of living with it is even worse. It's characterized by radiating arm pain, sensory disturbances like tingling or numbness, and even motor weakness. And all of this happens because the nerve roots in your cervical spine, that's your neck, are being compressed or irritated. It has a remarkably high predilection for middle-aged adults, and let me tell you, if left untreated, this isn't just a minor annoyance. It can severely reduce your physical function and just your overall quality of life.
Part 1. The Treatment Dilemma. To cut or not to cut?
So here is the great treatment dilemma, a medical debate that has literally been raging for decades. On one side, you've got conservative care. This is your non-invasive route, right? Physical therapy, anti-inflammatory medications, maybe even immobilization with a cervical collar. It's very often the go-to first step because, naturally, it avoids all the risks of going under the knife. But on the other side, you have surgical intervention. We're talking major procedures here, like anterior cervical discectomy and fusion, which is usually just called ACDF, posterior laminoplasty, or disc arthropathy. The whole goal of surgery is to physically go in, mechanically decompress that nerve, and stabilize the spine. And for years, the medical literature has presented very mixed findings. Some trials will tell you conservative care is just as effective, while others absolutely swear that surgery is the clear winner.
To put the sheer scale of this dilemma into perspective, just look at this number: over 1 million. That is the staggering number of ACDF surgical procedures performed in the United States between 2006 and 2013 alone. Over 1 million spine surgeries, and the utilization is only projected to keep rising. Yet despite this incredibly high rate of intervention, researchers noticed a surprising lack of high-level evidence definitively proving that surgery is superior to non-surgical care in the long term for everyone.
Part 2. The Investigation. Reviewing the evidence to finally crack this cold case.
Enter a massive study published in the European Journal of Orthopedic Surgery and Traumatology in April 2026. This study-level systematic review and meta-analysis really stepped up to the plate. The researchers rigorously searched medical databases and pooled the data from 5 randomized controlled trials, which, if you follow medical research, you know is the absolute gold standard. Altogether, this represented 435 patients. Their mission was straightforward: evaluate these patients side by side to finally determine which treatment strategy truly works better.
So, what did they actually find? Well, if we just look at the initial surface-level data, surgery looks like an absolute knockout winner. The pooled analysis demonstrated a significant reduction in neck pain that heavily favored the surgical groups. It also showed a significant reduction in arm pain, and on top of all that, surgical patients showed significant improvements in physical function. Honestly, if you stop reading the study right here, you'd think the debate is completely over. You'd assume surgery is the undisputed champion for anyone suffering from cervical radiculopathy. But as in any good detective story, the surface rarely tells the whole truth.
Part 3. The root cause matters. Finding the cause to uncover the aha twist.
The researchers realized they couldn't just look at the symptom, the pinched nerve. They actually had to look at how the nerve got pinched in the very first place. The two major culprits here are disc herniation and cervical spondylosis. Think of this as the jelly versus rust analogy. A disc herniation is kind of like a bursting jelly donut. It causes acute mechanical compression and inflammation of that nerve root. It's a localized, specific problem that a surgeon can go in, clean up, and decompress. Cervical spondylosis, on the other hand, is much more like rust on a complex hinge. It's a chronic, multifactorial, degenerative wear and tear process. It involves bone spurs and thickened ligaments. It's messy, it's widespread, and a single surgery might not fix it neatly because those degenerative changes might just continue anyway.
And this brilliantly illustrates exactly why that distinction is absolutely crucial. Look at this forest plot from the meta-analysis focusing on neck pain. They did a subgroup analysis based on the underlying pathology. Now, for the disc herniation group, our bursting jelly donuts, the data heavily favor surgery. The relief is significant. But look right below that at the spondylosis group, our rusty hinges. It is a dead heat. The black diamond is right on the line. There is absolutely no statistically significant difference between non-surgical and surgical management for patients whose pain is caused by spondylosis.
And guess what? When we look at the exact same subgroup analysis for arm pain, the trend is identical. If you have a disc herniation, surgery is associated with a clear, significant reduction in arm pain. But if you have spondylosis, surgery performs no better than conservative physical therapy. The root cause entirely dictates whether the surgery is actually going to be effective. It is a profound finding that completely shatters the idea of a one-size-fits-all treatment plan.
Part 4. Mind, Mood, and Medicine. Exploring the secondary outcomes.
Now, these secondary outcomes reveal something fascinating about patient expectations versus clinical reality. Even though surgery was clearly better at fixing the mechanical physical issue for herniation patients, it didn't automatically equate to a magically happier patient across the board. When measuring emotional or mood improvement, there was no significant difference at all between the surgical and non-surgical groups. For patient-reported overall improvement, which is essentially how satisfied they felt with their recovery, again, no significant difference. And perhaps most surprisingly, there was no significant difference in analgesic use, meaning surgery didn't somehow lead to taking fewer pain pills than conservative care. You might be wondering, why is that? Well, the study suggests that while surgery might offer quicker initial relief, non-surgical patients eventually catch up over a year or two through dedicated rehab. Plus, surgical patients sometimes experience lingering complications or have unrealized expectations that kind of temper their initial enthusiasm.
The final verdict: choosing the right path.
The absolutely crucial takeaway from this extensive meta-analysis is empowerment through information. Treatment success is entirely dependent on the specific underlying etiology. If you or someone you know is suffering from this condition, you simply cannot afford to be a passive patient. You have to be an active participant. You have to ask your doctor, hey, is this a disc herniation or is this spondylosis? Because as the data conclusively shows, the symptom doesn't dictate the cure. The root cause does. Surgery provides superior improvements for disc herniation, for sure, but it shows no clear advantage over a good physical therapy regimen if the cause is degenerative wear and tear.
It really requires a fundamental shift in how we approach healthcare. We have to look past the surface. So I'll leave you with this. Next time you face a medical dilemma, whether it's spine pain or literally anything else, will you be satisfied with just treating the symptom, or will you demand to know the root cause? Thank you for joining me for this explainer. Keep asking questions, keep looking at the data, and stay curious.